Hi, my name is Stephanie, and I'm going to be presenting on my research topic, the cost of prescription drugs, a rising problem. This is for the BSN program at Point Loma Nazarene University, Professional Writing. So to outline the problem, one of the things that I wanted to do is show the research that I found. The cost of prescription drugs in the United States is skyrocketing, causing financial and health hardships for many Americans. There is research below that shows some specific examples of where cost is hurting Americans when it comes to their prescriptions. Americans regularly pay far more for prescription drugs than patients do in other comparable countries. A recent study found that U.S. prescription drug prices were 2.56 times those in 32 comparable countries. So this compares countries of similar financial status and the fact that they're paying more or here than they are in other countries for their prescriptions. A lack of price transparency from pharmacists and physicians is creating financial conflict for patients during their visits to the pharmacy. Patients are not able to figure out how much they're going to pay before they go to get their drugs, and this is creating a problem when they get there, in which they're leaving without their prescriptions, or they're having to choose between filling possibly one or the other depending on their insurance. Insulin prices have risen by 200% from 2013 to 2022. This is disproportionately affecting low-income individuals. The Journal of General Medicine outlines this as part of the crisis related to prescription medication price rising. So for someone who has diabetes, they're paying a lot more now for the same medications that they've needed to control their blood sugar in the past. And a lot of them just aren't able to keep up, so they unfortunately are not getting their medication in some instances, or are having to take less at a time, which doesn't work to control your blood sugar all the time. The impact on patients. Patients are being forced to choose between paying bills, eating, having their medication, or other necessities. Sometimes it's, do I pay my car, or do I pay for my medication? In different instances for different patients. Patients are non-compliant with their medication treatment plans related to inability to cover costs. So they're skipping meds or delaying refills. So they're not able to continue to take their drugs as prescribed consistently because of the inability to afford the refills for their medications. And this is causing a non-compliance issue with meds, where a lot of patients are ending up in the hospital, they're ending up in the emergency rooms, or they're ending up, very ill because they're not complying with their treatment regimens. That brings me to the next point, that emergency room hospital visit rates are increasing due to non-compliance of medications. So because of the price gouging of medications in the United States, a lot of hospitals are seeing more patients coming into the emergency room because they're not taking their meds. And the number one reason why they're not taking their meds is because they simply can't afford their medication. The worst outcome for patients in this situation can be multi-organ failure or even death related to the lack of medication used to sustain life. I'd say the biggest example of this is going to be your patients, like I mentioned earlier, that are taking insulin, that are unable to comply with their treatment regimens because they can't afford their medications. So the proposed action to these problems and proposed policy changes are some of them below. They are cap rules that encourages to stop price gouging for prescription drugs. One of the reasons why these rules would be the most effective is if people were using them for, like, if federal and state laws were supporting the rules. That way they would work for everybody. What's happening now is people are supporting them statewide, but federal backing is not involved, so they're just not getting the point across as an actual law. There's gag policies to ensure price transparency by pharmacists before prescriptions are obtained. So what this would do is create a situation where patients can be informed of what they're going to pay before they go to the pharmacy to get their medications. This will possibly help them to prepare better to get their meds and have them covered by cost, or look into other options before they need to refill them or fill them that day. Another benefit for patients would be discount programs can be created for patients to have lower copay on meds or to get copay assistance through government programs. This would really help the individuals who are struggling with high cost deductible health plans or extreme copays for their meds that they just cannot cover. And as mentioned before, federal support for state efforts to protect patients is very important. If you have a state law and not a federal law that backs it, it may not be followed as the appropriate law for the patient. Another benefit to patients that could be created would be alternative medicine transparency. This would be a situation where the patients are told what other medications may be covered that would work for them under their formulary drug plan. That way they don't have to choose the most expensive option, and they can see exactly what else is available to them. Also, we can encourage education on copay cards, assistant programs, and alternative medicine, and also teach patients how to appeal their medication price decisions with their insurance companies in the form of prior authorizations or drug appeals. That way they can try to get their medications covered by stating that they've tried other meds and speaking with their insurance companies about the coverage of their medication. So lastly, I have what the nurse's role is in this change that is proposed through my research. And nurses can work alongside policymakers to ensure that affordability is prioritized in drug pricing decisions. In-services can also be provided to nurses by hospital and outpatient pharmacists or pharmacy representatives to educate them on different copay options for patients. A more knowledgeable nurse is going to provide that information to the patient in real time and assist them with their needs hands-on. Nurses can start to ask more questions, seeking information to better assist patients to save money on their prescriptions. By advocating for our patients for greater transparency and educating patients on how to navigate the system, nurses can take a first-hand approach at patient medication reform. So we can help our patients to save money and also to find the resources that they need in order to get their medications at an affordable price and to make sure that they are complying with their medication regimens. The last slide, you'll see the references that I used to conduct my research. If you wanted to look into anything else, there they are. Okay, thank you so much.